I'm Dr. Queen, like she said, and I'm so pleased to have helped organize and moderate this panel. And I want this to be a starting point for you, an appetizer for taking care of your heart health and taking care of your wellness. To do that, I want to kind of level the playing field between all of us so that we can actually get the most out of all the amazing answers that we get and the questions that we go over. So when we think about our heart, a lot of times we're like, oh, I don't know, am I doing the right thing? You hear about guys with heart attacks all the time, or women, not so much women. So what is it about heart disease and why do we have to pay attention to it? So these are statistics from 2023, and you can see this is what people die from in the United States. And it's divided between men and females, and you can see that heart disease is right at the top of what we die for. So if you look to your right at the woman next to you and look to your left, one of the three of you will suffer or die from cardiovascular disease in your lifetime. So it's important. I just want to stress to you, it's a little bit of a bummer, but there are lots of things we can do about it, and there's lots of things we can educate ourselves about to change that course. And by being here tonight is the first step you're taking to do that. So what does our heart do? As we know, it's both a plumbing and electrical system. And tonight we're mostly going to talk about the plumbing system. So your heart pumps the blood all over to every organ of your body. But then the heart itself also needs to get blood to work. So the blood vessels in your heart and the valves in those blood vessels need to stay open and clear to get blood and oxygen to your heart to allow it to pump. When those are blocked, that's when you get a heart attack because the muscle starts to die. What blocks these vessels? So slowly we can get some plaque that blocks the vessels that feed the heart, and then that part of the heart doesn't work so well. So what's the plaque in the vessels? What do most people talk about? Anyone? Cholesterol. Okay, so that's one of the things. So cholesterol. So what is cholesterol? So cholesterol is this waxy substance that floats through your blood, but it can't float by itself. It's kind of like oil and water. It will come to the top. So when we talk about these lipoproteins, like, can anyone talk about any types of cholesterol? Does anyone know some? LDL, HDL, VLDL, chylomicrons, all those different things. They're all cholesterol inside with some protein on the outside so that it can float through your bloodstream. And the proteins on the outside can sometimes tell us a little bit about how sticky those pieces of cholesterol are to make plaques. So we have a hint by the type of cholesterol you have and by some of the proteins on the outside as to whether or not they're going to stick and cause you problems. So here's a cholesterol molecule that you can see, and it has the cholesterol and triglycerides, which is fat inside. It has all the proteins on the outside. This is one protein that tells us a lot about whether or not your cholesterol is the type that's going to cause you a problem. It's an ApoB. There's another one that a lot of people are talking about, LPA or little a lately. So we'll probably discuss those later. So where does cholesterol come from? So a lot of people assume it's only what you eat, but it's not. It's 20 to 30% of what you eat comes into your bloodstream as cholesterol, and then your liver also makes cholesterol, because cholesterol is not a bad thing, right? You use cholesterol in your body to make every cell in your body, the membranes of every cell, in addition your hormones. So if you didn't have it, none of us would be here. So it's essential. The problem is the part that floats around in your bloodstream afterwards and isn't used for those membranes and doesn't go and get recycled through the liver and go out through the biliary system. So why is it important to us now to talk about it? Why are we all of a certain age range in here, and why are we thinking about cardiovascular disease? Well, one of the reasons is as your estrogen and progesterone decreases in your perimenopause and menopause phase, we see changes in the cholesterol profile that favor plaque buildup. And there's lots of different reasons. One is like how we recycle the cholesterol back to the liver, how we actually form cholesterol, but estrogen is a very complicated molecule, and it has a lot to do with that metabolic process that we were talking about before, between what we eat and how the liver produces it and how it recycles it. And it changes it so that the profile goes to the part where we start making more cholesterol or keeping more cholesterol that leads towards plaque. So do we see that in the statistics and with women and men? So you do see a difference in gender. So you can see here, if we start counting heart attacks and heart disease from 35 to 45 and go all the way up to 75 to 84, you see the white area, that's women. And you can notice it right away. That in this lower range, it's mostly men. And then you see women increasing and increasing and increasing till they're almost 50%. And you can see that the break point is almost between this 45 to 64. And that's at the point where we're losing some of our estrogen, progesterone, and our bodies are changing. So this is why it's important. So we have to think about, now we know we're at increasing risk for cardiovascular disease. So how do we determine our risk? Can you just say, oh, you're at risk of cardiovascular disease and you're not? It would be great if it was like a yes-no answer, if we could just have one blood test and it would say, yes, you might get a heart attack, no, you won't. But it's not that easy. So we have to do it by a risk profile. So we look at many different things, like your family history and your genetics, as well as your lifestyle, your metabolism, which is how your liver works, how your kidneys work, how you metabolize or use the sugar in your body and make it into good energy, whether or not you have diabetes, and then imaging techniques of the heart. And with that information, with your risk profile, like what percent risk you have, if you're high risk or low risk, then we can use the data we have to tell you, oh, you need to exercise more, you need to eat differently, you need to be on a medicine, you actually need an intervention. So you have to go through the entire process in order to figure that out. And tonight, what we're gonna do with these women who are here, who are amazing healthcare providers, who have saved my butt multiple times in the emergency department when I had a whole career before this working in emergency medicine. So they were the saviors of every heart attack and chest pain patient I had in the ED, and who have also saved me in my primary care practice. And so we're gonna start by talking about how do we identify risk. Then we're gonna start about how can we change that risk. And the third thing we're gonna talk about is what happens if we can't change the risk and we have a heart attack. Does that sound good? Yes. All right. So we can turn this off. I don't know how to turn it off, but we can turn it off.